Hello guys, here I am. I decided to create a video for you. I haven't been online for a long time, I know. As you all know, I've been in school and I don't even know, I kind of wanted to record a video for a long time since summer. I guess my last video was in summer, but I wasn't sure, like every time when I would start kind of mentally preparing myself that I need to record a video, what I'm going to talk about, my kind of motivation would disappear and I would be just postpone. And I feel like it's related to lots of factors obviously, but mainly it was related that I just wanted to be done and kind of feel my mind to be free from all this dental school stress and to have some milestone that is over and then to share with you, I guess, this video. And I was thinking, I had a lot of topics in mind and I kind of came up to this topic, and you can see I'm totally improvising. I don't have my notes like I usually do. I'm unprepared, and I thought I will just tell you kind of the truth. How was it? How did it go for me? What was going on in the advanced standing dental program? And I think this might help to all of you. Hopefully it will facilitate and make it easier for you to go through this program, and I hope that my advices and things that I'm going to share will just help others. I'm talking about international dentists who are about to enter or they're in this program, and that's for you. I've got a lot of requests. A lot of people were asking, how are you? Are you okay? Like, why are you not making a video? I'm very grateful to all of you guys, and you inspired me to make this video and to share my experience, my personal experience, and what was going on and what I would kind of advise you guys to make, that hopefully will make it easier on you, this program. So there is nothing to be scared about. The program is pretty straightforward, and for some it lasts like 2 years, some people it's like 2.5 years, like depending on which university you got in. So my program, at this point you all know that I went to SIU SDM and my program was 27 months. And here's now May. I don't know when I'm going to release this video, hopefully soon. So this is my last month, and then we have a graduation in June, on June 7. But I'm done with my requirements right now, and I'm kind of in sign-out process from school right now. By sign out, I mean that a lot of paperwork is left, but I'm done with clinics, and I just need to kind of sign out from each department, and it's like some bureaucracy. That's not too bad. Okay, speaking about bureaucracy. So first thing, to be prepared. Be prepared to a lot of bureaucracy in your dental school. By saying bureaucracy, I mean like besides like normal things that you need to learn or you already know, like dentistry related, besides the experience you gain, you also will be involved in a, I'd say how I think it's abnormal, and I think it's not supposed to be that way. The paperwork that will be thrown into you, and by paperwork I mean literally hand paperwork, such as letters to the patients, and mostly it is computer paperwork, like working with the computer program, where you have to navigate a lot of things such as referrals, change of procedure forms, like a lot of different forms. So how dental school is structuralized, because they're working with the primary insurance they're working with is Medicaid. I mean any insurance, but Medicaid in specific, they audit the school. So it gets very strict and serious when it goes to your notes, when the codes that you processed, obvious referral, and if you need some tiny corrections, that's not easy to make a correction. You need to file a lot of change of procedure forms, and it takes a lot of time. I mean, it's not hard, but when things like accumulate, like besides change of procedure forms, besides of a lot of this paperwork, you need to take care of patients, you need to call your patients, you need to take care of your exams. Like, you have a lot of other things which are kind of going concurrently. You cannot focus, unfortunately. This is the right thing. This is how our brain works. We perform the best when we focus on one thing at a time, and when we focus on one step at a time, right? This is the fact. But what dental school makes you do, it makes you to be very multitasking. And it's not good for your brain. When you're performing simultaneously like a computer, like, you know, you literally can lag or overload. When you're doing, at the same time, you're doing like, or your brain is like thinking about like multiple, I'd say like at least 20 different things. Sometimes when you go and you need to focus on a patient, they will start kind of attacking you with this business office, like patient didn't pay, and then your problem becomes that patient didn't pay, so you didn't communicate with the patient right, maybe patient cannot pay, then whole your procedure is cancelled. So a lot of such little things distract you from your main kind of goal. Your main goal is to learn and to get experience through the school and to get familiar to US dentistry, and all of that distracts you a lot. And besides distracting it, the school makes it feel the same important as dentistry. So if you cannot just not do this all forms or deal with business office payments, insurance, and I don't know, like everything else. You can't. You will fail. So you have to do it. But obviously, you remember that your main focus is dentistry, and it's kind of hard not to shift. So I think it's a very good experience-wise, because now, like at the end of my program, I understand, I think, way more about how Medicaid works, how most of the insurances work, how to deal with them, I don't know, with all these issues, how to prevent them better than dealing with them, right? How to make your notes right, how to make sure you communicate to the patient right, and all of that, then deal with it after. But it puts a lot of additional work and stress on you, and as I said, it distracts you from the main kind of purpose. So I'd say that's the main thing that you kind of have to figure out in this program. And I'm talking obviously about these clinics. So let me tell you a little bit my strategies. So they threw a lot of requirements on you. You will be, once you enter the clinics, you'll have a document where you're able to access all the dental school requirements that you need to finish in order to graduate. It seems like a lot. Every dental school is different. Our school, I mean, it's hard for me to compare, but from what I've heard, our school is on a high end of the requirements that you need to finish in order to graduate. Like, for example, for our class, denture requirements was very high. Like, I ended up doing like 7 arches of dentures, and sometimes they might lower these requirements. Every year it might change for different classes, like, you know, they adjust them and change it depending on a lot of factors. But you will be given this list of requirements, and just get familiar to them as soon as you can, and start kind of as you go, because you cannot plan anything right away because you don't have cases and patients. But as you go, start like a little bit moving towards kind of how to fulfill them. There will be a lot of things. Like, besides of clinics, you'll obviously will have your CDCA or credits exams. That's separate story completely. You'll have your classes where you'll have like just exams and classes. That's exactly separate story as well. And you'll have a lab work. So all of that goes concurrently and at the same time, and you just need to catch up. And sometimes you have to come on a weekend and do the lab work. And it is what it is. It's, like I've done it multiple times. And especially in our school, we have a lot of lab work. We, for like dentures, we set our teeth, we don't send dentures to the lab. Like technician doesn't set teeth for us. We set them in our school, which obviously takes a lot of time, and you won't be doing this in the real world. But from the experience-wise, I guess we gain more experience by that, which I would argue I would just maybe set like first dentures and then everything else I would have sent to lab, but that's not the case. So anyway, let me kind of, so you focus on your requirements. And at some point, you moving forward, like you have some cases, you'll need some other cases to finish. But what is the most important thing? And I'll tell you how I survived and how I did pretty well. I'd say I'm proud of myself, and I think I handled everything well. I'm done a little bit early. I'm done with all my requirements. I've had a lot of good cases. That experience that I wouldn't, like, it's not everyone obtained that experience. I'll share that as well with you. But what was my strategy and what I think helped me a lot? So establish relationships with your patients. When I just entered the clinic, I was given some patients. I was throwing them, not just new patients when you examine, and each school works differently. So you have your new patients rotations where you get new patients, and also some patients are transferred for you from upper class students or from just in your class students even. And you don't know when you get this case why this patient you got, unless it's new patient, but I'm talking about not new patient, current patients. But mainly sometimes they give away the cases because they don't need, they're already done with the requirement and they don't need this anymore. Usually it's regarding the operative or sometimes perio. When I say perio, I mean they usually give away some easy perio, prophylaxis, for example. And sometimes another case, some students give away the patients that they couldn't find a bond with, they couldn't connect well, and that happens to everyone. Or a third case, which is the worst, upper class students often give away the patients that are not compliant, that don't follow the appointments, that miss a lot of appointments. And I'd say more about that in Illinois, you all know, guys, I'm in Illinois, there is a particular, this is a problem. There is a high level of missed appointments. I think, I cannot compare, but that's what I've heard, that it's higher than in other states. Patients just miss the appointments because no one knows why anyway. But that's kind of in Illinois happens more often. And that's the kind of patients that are given to you from upper classmates as well. And you don't know that. You can read the note and kind of understand it from notes, from the whatever you read in a chart, but sometimes it's not that easy to understand that unless you invite the patient and they just don't show up to your appointment. And that's kind of waste of your time, because you're given limited time in clinics where you can perform something, and if the patient doesn't show up, that's the worst case scenario that can happen to you. So try to send, there is special protocol that a student can help, you can file letters, there is rules, just follow these rules and be organized, because you cannot, you cannot do anything which is not you have no control of, you cannot make patients to come or show up, but you can do and focus on what you can do. And there is protocols a little bit to maintain and maybe improve their compliance, such as letters and calls. So every school has it different. Anyway, what else I would kind of suggest that helped me, as I said, I I didn't have like at some point you kind of realize exactly what you need to graduate, and you not often have these cases. Even if you assign to new patient rotation, you still might not get the patients with the cases that you need, and it is life, you know, it's like a lottery. I'd say you very seldom, I'd say twice I got, I'd say, lucky in dental school, only twice among like, I don't know how many patients, hundreds of patients that I've seen, only twice, only 2 patients were suitable and amazingly compliant, and just I think that I was just lucky, and I was able to, on one of these patients I just done a crown, and the other one was easy and compliant, and she needed a crown, and I did my comp crown on her. Regardless that it was tooth number 2, I still decided that that's my best patient to comp my crown, because she's compliant. She's coming to every appointment. She is never late. She understands how dental school works, because for lots of patients, they don't know, and I feel like we explain that, but maybe not enough, or maybe they just don't want to know that. It kind of gives them more leverage. They don't understand that to finish a crown in dental school, it's not a 2 appointment situation or even 1 appointment situation like it's in private practice, right? You scan meal and you're done. Prep, scan meal, right? It's not. In dental school, it takes like 2 appointments, best case scenario, but usually takes 3 or 4 appointments, and each appointment is 3 hours. And from this perspective, I clearly understand the patients when they don't want to go and waste so much of their time. You know, imagine you need to spend 4 days like of your time just to get this crown done. This is like, you know, time is money, and you're supposed to be free or not working, or I don't know, or schedule it around your work. It is kind of hard, like with, I don't know how they do it. So anyway, what helped me at the end of the game, that build relationship with your patient. I would say all my cases, like main cases that I got to finish and I'm very happy about, were with the patients that I started from the very beginning. So my second comp crown, I treated this patient for 2 years before I met her in summer. I was given she was giving me for operative. I've done enormous amount of work with her, like whatever she needed. And at some point I was like, there are some old amalgam fillings, but they still look okay. We've done like our exam, we've done bite wings, everything looks good, nothing bothers her, there is no caries, nothing. And I was like, yeah, she has several old amalgam fillings, which are probably like more than 10 years old, but they are still kind of fulfilling their purpose. So I was like telling her, I don't know, maybe I'll see you in 6 months, maybe I will just refer you to hygiene for cleanings. And I had a conversation with her that you have this old amalgam fillings, but that's not like ethical to recommend to replace them just because they're old and they're amalgam. There has to be more than that. There has to be, there has to be some diagnosis that's not like appropriate. So I was, anyway, I was happy with this patient, and I just told her, like, I'll see you in 6 months for exam, and everything. If everything is good, we'll just refer to hygiene, since you don't need any treatment. You'll be just doing cleanings. And when I was like spring this year, and I was searching for my cases, and I needed a crown comp to graduate, I invited this patient for this exam, which was 6 months later. And I've spoken to her, and you know how they don't tell you anything on the phone, but then when they appear, and right away they appear and they say, oh, my tooth is cracked, or something is going on there, can you check it? And that what happened to her, this old amalgam filling cracked, and it was large, big amalgam filling. So at that point, this tooth needed a crown. And I told it to the patient, and first thing that I told her, because she became my friend, like that's what is the most important. Establish true relationship with your patients. I'm not saying like friend, but friendly. Like like, so they see that you genuinely care about them. And I feel like I succeeded in that. And because I established this relationship with her, I was able to tell her exactly honestly, like obviously I told her everything that was going on with her tooth and what needs to be done, but also I was able to communicate with her honestly and tell her that I need this crown to comb. This is, she knows this is dental school. I was like, I will either refer you to another student because I don't want to start doing this crown and then not be able to finish it, like, you know, because it will take at least, like, not at least, but 3-4 appointments to do this crown. Or if you have time, and I'll just explain you what I need, if you're able to come like straightforward, schedule all these 3 appointments right away, and please don't miss them, just show up and we will finish this crown and everything will be good, and I will get my comp crown through that done, and that will help me to graduate. I told her that, and she was like, oh my gosh, Nina, of course. And that, I was like, my heart was broken when she was telling to me. She's like, I have nothing to do, I am retired, I'm gonna come to all these appointments and we will finish them on time. You won't need to transfer this case. And that was it. That was just because we had this relationship. And I know it's hard to understand, but when times comes to the graduation and you need something, you cannot rely on luck or that team leader will give you a good case, because that's not how it works. They might not have good case, or they might have some, they think they don't know what case they're even giving to you, because they're not treating this patient. They're looking in database and they are kind of thinking maybe this needs a crown, but it has to be evaluated clinically. Or even if they can look at x-ray and they think that they can give you this case for crown comp, but it can be 20 different things. This patient can be not compliant. This patient can live far away. It's like, you know, you never know if this patient will show up on these 3 appointments straightforward and you'll be able to finish this crown. Because you know what is one of the problems that every dental student suffers the most is they're not able to finish what they started. And no matter how well you explain that to the patient, there are multiple other things that are happening in their life. And for most of them, I'm not saying for most of them, but for lots of them, that's not a priority to finish their crown, to finish their root canal, to finish their even fillings. So when I was making my strategy at the end of the semester, you kind of need to know exactly which patient will be your comp crown, which patient will be your comp denture, which patient will be your second comp crown, because we have to go to digital and conventional, which patient will be, I don't know, your amalgam class 2 comp, or whatever comp you need. And I made most of these comps on the patients that I've known for 2 years. It's like I literally was kind of happy because I didn't do this treatment on them in the beginning. I was mainly doing operative on them and establishing connection with them. And then at the end of the game, they ended up kind of needing either crowns, either bridges, either like some denture patients. I've dealt long time with them, communicating and over-communicating their treatment plans. And sometimes patients would just come and we would just discuss. Like, you know, you have like multiple treatment planning appointments, but it kind of wastes your time too. But I engaged in that and I've done it like a long time. So anyway, that's my advice. Like, if you established relationship with the patients and you kind of get frustrated because you don't have like your comp crown or anything, that's what might save you. At some point this patient will come and at that time they need something for real, like there is an indication. And then like once like she said that my life was set, I was like, here, and like I have my comp crown and I knew she would be showing up, and it was like wonderful relationship, you know. And obviously it ended up to be wonderful results, because besides that we both were happy with our work, we both like kind of gained something that we needed. Like she gained treatment, I gained my graduation requirement, right? So that's how it works. And don't expect that the crowns or whatever you need to finish your requirements will just fall on you and it will be a perfect patient. There is no such thing as a perfect patient. As I said, I was lucky only twice. All other patients were wonderful and I love all of them. But you have to establish this relationship. You have to work with your explanations, with the treatment plan. You have to explain, and there is no such thing as over communicating and over explanation. And patient can feel that. They can feel how much you try hard, and they become appreciative if they see that you are trying very hard to not just do something on them and kind of take money, right? But you don't get money, but for school. They don't like this treatment. They can feel it, like, you know, if you go to the doctor, like in real life or anywhere, when you go and you feel like somebody tries to sell you something quickly, you feel it like with your skin, right? And you usually don't agree and you get kind of disappointed. The same thing is here. Just be honest and establish this relationship. And it all comes from hard work again. So, as I mentioned, all the cases that with my comp denture case, that's so touching too. Like this patient told me she'll remember me till the rest of her life, and it's kind of quite a personal story. But I'll tell it short. I doubt. I don't know if she'll watch me or not, but she'll laugh hard if she'll watch this. We didn't start well, and we worked together very hard, and we went through a lot before we even started doing the dentures on her. But once we kind of started working and communicated, and I was answering all questions, whatever questions they have, it ended up such a wonderful case that we both were happy. And then last appointment, she clearly told me, I felt like I don't need even to come. Nothing bothers me. The only reason I just came is just because I didn't want to make it like kind of rude and not show up. And she came and we just had a good chat, and she was happy with her dentures. I was happy that she's happy, and it's my comp case, and I got a good grade. And I don't know, I'm just telling you, like, that what saved me. I never made a bet on some luck or somebody will give me good patient and it will just be magic and it will just work out. No. I built my relationship with each and every patient, and of course I remember everything what was going on, and we just built it, and it became very good personal doctor-patient relationship with each of them, and that what saved me at the end. And you know, when patients feel from you that you are trying to help them, they're giving you back. They want to be compliant and show up and everything. So that what was going on. I'm finally done. It's like, you know, you never can say that you are done, because whenever you feel like you've done with one milestone, there is another goal or purpose comes over, and I cannot even keep up with my planner and what I'm writing down that I need to do. I'm trying to be productive every day. Like now, obviously, I'm focusing on signing out process, but simultaneously with signing out, I'm focused on how to file and documents to obtain the license. Simultaneously, I'm thinking how to move out from this apartment, because I'm moving back to Nebraska, and it's a lot of things. Like, you know, I cannot even tell you. Like, I need to sell my furniture, like to organize all movement, to anyway, so much things to do, and I don't know when it will be over. I'm looking for a job, I'm applying, I'm having interviews. If that's something you'll be interested to hear, I can make a video about that. I don't know. I don't know if I'll make more videos from here, or my next video will be from Nebraska. It's hard to say. I'm definitely not quitting my channel, and as I mentioned, I'm grateful to you guys that you were texting me and telling me, hey, are you gonna make a video? What's going on? That was very nice. I've received a lot of requests to help with SOP and overall application, and I just probably answered that to everyone. I'm so busy, and I apologize, but I'm not helping anyone with that. I just don't have time on that. But I'm still grateful you wrote me a lot of these texts and through Instagram. I appreciate if you have some particular questions I'm trying to answer usually, but please just, I'm trying to share everything is in my video, and I'm definitely feeling overloaded, and I don't have kind of time and sources to help to file application. And also, I'm not the best source for that anymore. That was a while ago. Like, I filed my application like 3 years ago or so, and things change all the time. So I would say it's probably better to ask somebody fresh who just got in, and they probably are better at that than me. That's obvious. That's how life works. Anyway, on this note, I'm gonna finish this video.